2.3 million Americans currently live with epilepsy. Epilepsy is a neurological condition in which the nerve cell activity in the brain is disturbed. This causes a seizure where one experiences abnormal behavior, symptoms, and sensations, including loss of consciousness. The seizure occurs when clusters of nerve cells or neurons in the brain send out incorrect signals. The etiology of many causes of epilepsy is still unknown. It can be caused by illness, brain injury, or abnormal brain development. About 1 million of those with epilepsy live with uncontrolled seizures. People suffering from uncontrolled seizures live with the continual risk of serious injuries, neuropsychological and psychiatric impairment, social disability, and loss of life. A number of people suffering from epilepsy have reported beneficial effects from the use of medical marijuana. The use of medical marijuana has decreased seizure activity in many. More data is needed to determine the actual benefits of medical marijuana used for treating epilepsy, but animal studies and clinical experience suggest that marijuana or its active constituents may have a place in the treatment of epilepsy. There has been some research suggesting many benefits of cannabidiol. The use of medical marijuana to treat children with Dravet syndrome has been a very popular debate and argument for the use of medical marijuana. Dravet syndrome, also known as severe myoclonic epilepsy of infancy, is a rare and catastrophic form of intractable epilepsy that begins during infancy. Those with Dravet syndrome face a higher incidence of sudden unexplained death in epilepsy. A 5-year-old girl named Charlotte Fiji suffered from this rare form of epilepsy. She suffered from about 300 seizures a week and was to the point where she was not functioning and was told that she did not have much longer to live. Her parents had tried every type of treatment they could possibly find with no other choices. The family explored the use of cannabis oil. Charlotte went from experiencing 300 seizures a week to experiencing only about 2 or 3 per month. The special strain of hemp she used was developed by the Stanley family, based in Colorado, for the purpose of bringing the extremely beneficial cannabinoid to patients who needed the therapeutic benefits of the plant without the psychoactivity accompanied by THC. Charlotte was able to prove that the drug had benefits, and due to her miraculous recovery, the special hemp strain was named Charlotte's Web. The Stanley brothers now run the Realm of Caring Foundation, and they currently have 100 patients who have moved to Colorado from 43 other states. And there's a waiting list of more than 2,000 people who are willing to relocate. An additional 4,000 Colorado residents are waiting for Charlotte's Web. There are many cases similar to Charlotte's. Jordan Lyles is 11 years old and also has Dravet syndrome. She experiences drop seizures, which causes her muscles to go limp. The medication they had her on took her speech away for 2 weeks, along with her ability to eat. Her mother decided to uproot from Ohio and move to Colorado after hearing about medical marijuana. Her mother had to leave both her husband and her other daughter to get Jordan the help she needed. Jordan was able to reduce her medication by 50% as a result of the use of medical marijuana. Allie Swan is a 14-year-old from Alabama. She was diagnosed with intractable seizures and has had 2 surgeries, including one to remove her right frontal lobe at age 6 after neurologists found a spot that they determined the seizures originated from. She was having about 203 seizures per day at the age of 6, and they went down to about 50 to 100 after the surgeries. She was on about 20 different medications, but they had bad side effects. Her family also had to move from everything they knew to Colorado to receive help for Allie. There are many cases such as these where children are getting better, but families have to move everything. More than 100 families have moved to Colorado over the last 9 months to receive the help they need from medical marijuana. Families should not have to move across the country just to receive care for their child. Due to the fact that marijuana is classified as a Schedule I drug, there are many restrictions involving testing and research. The classification of marijuana means that it does not have medical value and a high potential for abuse. It is placed in the same category as heroin, LSD, and ecstasy. The Epilepsy Foundation has called on the Drug Enforcement Administration to implement a lesser schedule for marijuana so that it can be easily accessible for medical research. The only way to know medical marijuana is really helping people, and to ensure the safety of it is to be able to test it. And the Drug Enforcement Administration is making that very difficult. We do not know a lot about the medical use of marijuana for epilepsy, but more research could easily fix this. Overall, the regulations on marijuana need to be rethought. If a patient and their healthcare professionals feel that the potential benefits of medical marijuana for uncontrolled epilepsy outweigh the risks, the family should have the right to obtain medical marijuana. They should not have to move across the country to receive proper care. Families need to have this legal option now, not later. Some families may be able to move across country and their children are dying, may not be able to move across country and their children are dying because of this. Medical marijuana has helped so many and could help so many more.